I was raised at Foster, Nebraska. My dad was a farmer. I guess he wanted me to be a farmer, but I didn't want that.
As he got older, he was in the Marines and was a bugle boy. He met my mother in the late 40s. He and Mom could really cut the rug.
I graduated from med school in 1955 and then came back to Omaha after my residencies. When I came back to town, I just came in cold. There was no one else here doing pediatric surgery. Nobody even knew what a pediatric surgeon was. And so I went to Charlie McLaughlin because I always admired him a lot. And he said, well, you can come, but it'll be 7 years before you get any patients. Because, of course, pediatric surgery was done by everybody. The first patient I ever had that I got was July 17th. I started practice July 1st. I did sit 17 days before I had a patient, and that patient was in an accident, and I fixed him up in the middle of the night. I never got paid, so that wasn't too good a start.
Loyd built up an immense repertoire of approaches to different kinds of pediatric surgical procedures. And over time, he finally took somebody into his office with him when he needed some help because it was grueling because he was on call 7 days a week, 7 nights a week, 52 weeks out of the year.
You have to understand what a pediatric surgeon is. That's probably one of the ultimate specialists to begin with. They deal with 2,500 and 2,000 and 1,500 gram infants. I mean, you're talking about doing surgery on something as small as a shoebox or smaller.
We had had a bit of a disaster at the zoo. Our hospital had burned down, and we had a baby gorilla that we needed to do a cut down on and get a catheter in. And Otto Rath, our pediatrician, and the pediatrician at that time for all of our zoo babies, our gorillas and orangs, said, I know a good surgeon, and he called Loyd, and on a Sunday afternoon, we just kind of rushed a baby gorilla into the surgery at Children's, kind of just blew past everybody, and had him on the table, and there were no other patients in the surgery at that time, and Loyd just said, a baby's a baby. Well, you might say that Dr. Schultz contributed to the conservation of gorillas in North America.
He bred confidence. Wasn't a place in town he wouldn't go. There wasn't a child, if you asked him to see, he wouldn't see. And he once said, and I think it's probably the most important part about him, he was a pediatrician who did surgery.
He's built children's surgery into the beginnings of the modern era that it is today.